Hi, my name is Hadassah Adorno. I'm going to be talking about myocardial infarctions and cardiac arrest for my Anatomy and Physiology 2 class. I'm also going to be talking about which one has a higher mortality rate and a poorer prognosis. First, I'm going to talk about what a myocardial infarction is and what cardiac arrest is. A myocardial infarction is better known as a heart attack. So this happens when the coronary arteries are blocked. They're not, usually it's by a blood clot. So the heart's not getting enough oxygen. It's not getting the blood that it needs. Coronary arteries are responsible, kind of like what I just said, for bringing blood to the heart. So since it's not getting its supply of blood, this is going to lead to cardiac muscle death. No oxygen, no ATP, cells die. Usually the cardiac muscle is replaced with non-contractile scar tissue, which is a problem because it needs the heart needs the contractile tissue in order to contract and pump the blood throughout the body. Cardiac arrest is different. Usually it's mixed up with a heart attack, but it's different. It's the complete loss of heart function, breathing, and consciousness. So this means the heart stopped working, you stopped breathing, you're not responding to anything, so you can't ask for help. Now I'm going to move on to causes and demographics. I kind of explained this before, but myocardial infarctions is caused by coronary artery blockage, so decreased coronary blood flow. This can be due to atherosclerosis, buildup of plaque in the arteries, coronary artery embolisms, which are blood clots, coronary dissections, or vasospasms. You can kind of think of it this way: garden hose and a plant. The plant is going to need the garden hose to supply it with appropriate amounts of water. So, say there's a kink in the garden hose, or someone has stepped on it, or there's a heavy object on it. Wherever that is placed is where the flow of water is going to stop. In this case, it's blood. So since it's stopped there and it's not moving forward to the end of the hose, the plant's not going to get the water that it needs in order to grow and thrive. So if the plant doesn't get water, it's going to die. About every 40 seconds in the US, someone has a heart attack. And the average age of a person's first heart attack will be when they are 65 years old in men and 72 years old in women. About 750,000 people per year have a heart attack. 30% of myocardial infarctions result in death. Cardiac arrest is different because it's deviation in the normal heart rhythm. So usually it's because of ventricular fibrillation, or it has to do with something wrong with the sinus node. So the sinus node is responsible for the electrical signals that go through the heart. They're the electrical stimulators for it. More than like 350,000 people per year have cardiac arrest outside of the hospital, and about 290,000 have it in the hospital. And 70 to 90% of people that have a cardiac arrest die. So now I'm going to talk about what's affected and what are the symptoms. So in myocardial infarctions, the coronary arteries are what is affected, and then since they're blocked and no oxygen's going through, the cardiac muscle's dying. Symptoms include dizziness, nausea, chest pain, shortness of breath, pain in the arms, neck, shoulder, jaw, and they also sweat. So with cardiac arrest, the entire heart's affected. The heart's not doing its job. The main symptoms: loss of consciousness and unresponsiveness. For how it's diagnosed, for diagnosis in myocardial infarction patients, blood work and EKGs are used. So when you have a heart attack, certain proteins and enzymes are released into your blood. So that's why they take your blood whenever they suspect you're having a heart attack or have had a heart attack. They're looking for those proteins and enzymes to confirm. Now with EKGs, electrocardiograms, what they do is they replace electrodes, the sticky things they put on your chest and your limbs. These record the electrical signals as they go through your heart. For cardiac arrest patients, going back to the EKG, EKGs, they can kind of tell you whether you have had a heart attack or if you're having a heart attack, because your electrical signals aren't going to read as normal. For cardiac arrest patients, you're also going to have an EKG, or you can have an angiogram. An angiogram is when they stick a really long tube called a catheter into your bloodstream. So they distribute a dye called a contrast agent. So that way, under X-ray, they can actually see what's going on in your blood vessels and your arteries. They can kind of like see if there's a blockage or a tear or something like that. So earlier I mentioned myocardial infarctions and cardiac arrests are usually confused for one another. I think one main reason for that is because they have similar symptoms. So like both of them will have shortness of breath, dizziness, chest pain. But the one main difference that they have is for heart attack patients, myocardial infarction patients, they're awake. They haven't lost their consciousness and they have that pain that's radiating to their arms or their shoulders and whatnot. But for cardiac arrest patients, they become completely unresponsive and they become unconscious. So let's see. Moving on to how they're treated. Myocardial infarction patients are usually given aspirin, mainly to chew, because that actually it makes the anti-blood clotting properties of aspirin work faster. Thrombolytics, those dissolve the clots that may have formed in your arteries. Antiplatelet agents, platelets are what make you form blood clots. Nitroglycerin, it helps widen your blood vessels. Beta blockers, they relax your cardiac muscles. And statins, they control your level of cholesterol. Cardiac arrest patients are usually treated immediately with CPR, cardiopulmonary resuscitation. Wow, my bad. Defibrillation with an AED, which is an automatic external defibrillator. Cardiac catheterization. So the catheters that I mentioned earlier, they can also use it to go in and repair whatever may have gone out, take out the blood clot, whatever. And respiratory support, such as like ventilators. So usually EMS will respond and they'll bring a manual ventilator so that we can pump oxygen into them while you're doing the chest compressions. Well, not at the same time, but it's besides the point. Effects on lifestyle, functionality, and prognosis. So after a heart attack, patients need plenty of rest. I think that kind of goes the same for cardiac arrest patients, but they'll also need to exercise, manage their stress, have a healthier diet, and as well as quit smoking if they're smoking. The prognosis for myocardial infarctions really depend on how bad it was and where it was. So for instance, if it happens in the left ventricle, the prognosis is more grim. The systemic pump, the left ventricle, is important to provide oxygen and nutrients to the rest of the body. So obviously if something goes wrong with that, it's like the most powerful part that's bad. Advanced age, vascular diseases, diabetes, and all that good stuff are also responsible for poor prognoses. Cardiac arrest patients that survive, however, they're more likely to have like brain injuries and neurological deficits afterwards. Their prognosis is much more poor than someone who's had a myocardial infarction. And some can even suffer a stroke after they have that event happen. Again, the poorer your health, the poorer your prognosis. Both myocardial infarction and cardiac arrest patients are likely to suffer anxiety, PTSD, and depression because you went through a severely like traumatic event. You're probably going to be scared that it's going to happen again. You're probably depressed because you need to rest. You can't go to work. You're worried that it's going to happen again. So it's only natural after going through that. So with either of these, your heart becomes weaker, so you're going to need to take care of it. You're going to want to avoid the risks that can cause it to happen again. That being said, cardiac arrest is more deadly. It has higher, not only does it have a higher mortality rate, I mentioned before, myocardial infarctions have a 30% mortality rate, whereas cardiac arrest patients have a 70 to 90% mortality rate. But not only that, cardiac arrest patients need like immediate intervention and treatment within minutes. If they don't, they're definitely going to die. So like, and also because it's asymptomatic, which means they don't usually have symptoms before it happens, most people don't know it's happening until it's too late. Going back to needing the immediate treatment, CPR and defibrillation with an AED is needed almost immediately because you are acting as their pump. Since they can't pump their heart, the heart stopped working and they stopped breathing, you are literally pumping the oxygen and the nutrients needed for this body to survive until help can arrive. So, that being said, I think I've answered all the questions, and that is about it. Thank you for listening.